Hello friend, in this video let's understand global aphasia. Global aphasia is a communication disorder where almost all parts of your language are affected. Speaking, listening, reading and writing. People may only get few words out or repeat the same phrase again and again. But here's the important part. They still feel and think. Many use facial expression, gesture and tone of voice to get their message across. So, what causes global aphasia? Well, the number one cause for global aphasia is stroke, especially when the blood flow is cut off in the brain's left language area. There are other causes too, like traumatic brain injury, tumors, infection of brain, and disease like Alzheimer's. When both major language centers in the brain, which is your Broca's and Wernicke's area, get damaged, the language highway shuts down, leading to global aphasia. So, what are the main symptoms of global aphasia? Well, when it comes to speaking, patient can speak very few words. It's just sometimes some automatic phrases will come out. When it comes to understanding, even simple questions like yes and no can be hard sometimes. Reading and writing is equally disaffected when it comes to global aphasia. It's very limited or absent, but non-verbal skills will remain. Patient can gesture, nod, give a familiar smile to communicate. How does it affect life? Well, the life of patient at the same time caregiver is drastically affected. It's not just about language. Many people will face depression, anxiety, social isolation with aphasia. Physically, global aphasia often comes with weakness on the right side of the body, vision problems, etc. Everyday life, relationship, work, even simple tasks can get overwhelming. So, how it is diagnosed? Doctors uses brain scan to see where the damage is, and special language tests like Western aphasia battery to measure abilities is used. They also need to rule out other conditions like Broca's or Wernicke's aphasia, which look similar but aren't as severe. So, what are the treatment options when? Well, there's no quick cure, but there are always way to help. First comes speech therapy, the gold standard, using gesture, music, rhythm, or picture boards to rebuild communication. Use of technology helps a lot here. Applications, tablets, and even speech generating devices can be very much helpful when it comes to global aphasia. When it comes to medication and brain stimulation, some drugs and techniques like TDCS or TMS show promise, but research is still growing. Let's talk about family support. Caregivers and loved ones are the key. They help, they can practice, they encourage, and they can help find alternative ways to connect for patient and society. So, what about recovery and hope? Recovery is definitely possible, especially in the first 6 months after onset, because neuroplasticity is at its peak at this time. Some people regain major skills, others improve only little. This all depends on age, size of brain injury, early therapy, which will make a big difference. But here's what matters: even if words don't come back, communication still does. Through gestures, technology, and human connection, people continue to live, love, and share meaning. So, global aphasia may silence language, but it doesn't silence the human spirit. The technology, therapy, and support communication always finds a way. So, if you who are someone who is suffering from aphasia, or else your loved one is suffering from aphasia, don't give up. Continue working in the right path. This channel is going to help you to do that. We will come up with a lot of strategies and practice guidelines to help you to work towards aphasia management. So make sure to like, share, and subscribe. On that note, I'll end this video here and I'll see you in another video. Thank you.